What's going on, everybody? Welcome to the Freedom to Flourish podcast. My name is Dr. Tim Augustiniak. I'm here with my good friend and colleague, Dr. Joel Miller, and we have an awesome episode lined up for you guys today. Today's episode, TMJ Issues. So for those of you who have no idea what that acronym means, temporomandibular joint is fancy anatomy talk for your jaw. So the temporal bone and your mandible or your jawbone come together and form your TMJ joint, which is where your jaw attaches to your head. There is a very, very in-depth mesh network of fascia, muscles, all kinds of things that come together at the neck, the jaw, you name it. So it is a very common place where people are going to have dysfunction. And the crazy part about the jaw is, you're gonna find out throughout this episode, there are so many different things that can feed into TMJ issues. It is not just, hey, do some muscle work here and it'll be good. When that is the case, that's probably a super easy day for us, but usually it goes well beyond that. Mm-hmm. So if you who are listening have chronic headaches, migraines, jaw pain, jaw clicking, jaw tracking issues, facial pain, any of the above, you name it, neck pain, this episode is really going to talk about something that could very well be driving all of that. The jaw is a common denominator with a lot of those problems. So if you fix these things and fix the jaw, often you'll be able to fix all of those other things. It could be that those other things are also caught in the crossfire of what's going on with the jaw, just because it's so diverse with the fascia, muscles, all the things that connect it, and their organ muscle relationships. There's just a lot of things that can be involved. So anyway, it's going to be a great episode. I think this is going to be good. So anyway, Dr. Joel, what are your thoughts? How you doing this morning?
Hey, good morning. So glad to be here. I think that this is a really good topic. It's not a topic that we see a ton of in the office, of course, but for the person that does have this issue, there's not a lot of great resources out there to discuss it. And so I'm excited that we're going to take our kind of holistic approach to this and just give some really good insights and information on things. You know, the interesting thing about the temporomandibular joint is it's a lot different from other joints in your body. It's considered a hinge joint, which essentially means that, it's very different from your knee. Okay. So your knee is going to have, for example, the end of the femur and the tibia, and they're connecting. There's a meniscus, and there's a bunch of ligaments, and there's a bunch of muscles around it. The knee joint is going to be it's going to be a joint that's designed for weight bearing. The TMJ, or the temporomandibular joint, is going to be more designed for movement. And so as a hinge joint, it's really connected purely by muscles. It's really very similar to the shoulder. And when we talk about joints and joint health, there's this whole balance, this scale between the more movable or the more like flexible and functional a joint is, usually it's going to have less stability. So the shoulder has a lot more movement. It's going to be it's going to have less of that stability factor. Same thing with the TMJ. Now, when I talk about stability though, and overall kind of what keeps this joint in place, it goes back to the muscles. And so, yes, between the temporal bone and the mandibular bone, there's that disc. And that disc is really important, but more important than that is, like you said, the muscles and the fascia that connects this TMJ and ultimately helps with its movement. Or if things are really angry, the thing just locks up and gets tight, and then people can't move their jaw. But like we talk about, Dr. Tim, with all of our other topics and all of our other episodes, there is a connection between your fascial health and your internal health, and that connection is through the nervous system. So we'll get into this, of course, but most of the time with TMJ issues, it's not, I think we would both argue, it's not a primary issue where all of a sudden the TMJ is just a problem, unless there was some kind of injury to the jaw or an injury to the face. Most of the time, these are secondary issues that come from internal problems. Internal problems then cause fascial imbalances, and those fascial imbalances cause dysfunction with how the jaw tracks, and that can lead to tightness, that can lead to inflammation, that can lead to so many things. Dr. Tim, I know one of the things that we wanted to talk about as we kind of start is, like, what's the kind of the mainstream approach to TMJ stuff. Well, the mainstream chiropractic approach and the mainstream medical approach. Let's kind of talk about maybe the chiropractic approach first, and then we'll jump into the medical approach, and then we'll talk about, hey, what's our perspective on these things?
Yeah. There's just a lot of connections. End of story. So with traditional chiropractic, I don't even want to say philosophy because it goes beyond philosophy, but traditional, I guess, physiotherapy, chiropractic, anything beyond just trigger point injections for the TMJ and surgery, any conservative care that is involved with the musculoskeletal system to treat the TMJ really is rooted in the idea that there is an imbalance of muscles on one side versus the other side of the jaw. So our jaw basically functions kind of like it's kind of suspended. It's kind of like a saddle that can kind of just swing back and forth. And if one side is super tight, it can actually pull one way and cause pain on the side that's tight, or can cause jamming on the side opposite to that and cause pain on that side. So it's really not tightness, lack of mobility, you name it, whatever you want to call it. It's not a great predictor for where your pain is going to be located. And so traditional fix for it is, well, let's do trigger point therapy. Let's put a glove on and stick some fingers in your mouth and work on the internal muscles that coordinate jaw movement, as the neck muscles and then the external jaw muscles, all that stuff. But it's often, by the time that patients end up in our offices, it is something that will reoccur time after time after time. And so they'll be like, okay, well, I went to go see my myofunctional therapist, or I went to see my PT, or I went to go see whoever. And it just keeps coming back. It'll feel good for a day or a couple hours or until I eat the next time or something. And then all of a sudden problems come back. So the question is why? Why is there some inherent instability there? Why is there something that keeps resetting? And so that's where we kind of dig into using the techniques that we use in the office, systems healthcare, to really identify other underlying issues. So there's kind of a couple different avenues that we'll go about this. So first things first, there's a couple like token issues that you're like, okay, if you have this issue, there's going to be some TMJ involvement just because of the organ muscle relationships and how things work with the technique. For example, just to highlight to our listeners what I'm kind of getting at. So we've talked about in prior episodes, but the systems healthcare technique, the muscle testing that we do, is rooted in the idea that organs have muscles that are related to it. So as we're developing, we start off as 2 cells, then it's 4, then it's 8, 16, so on and so forth. Our brain and spinal cord will develop first. And then from there, everything kind of migrates outward. So we have connections between organs and other tissues and reflexes that have ties into adulthood based off of that migrating outward from that same section of our spinal cords. With that being the case, if you're having, flank pain or pain over your gallbladder, the gallstones, that's called visceral referred pain area. Or if you're having a heart attack, left arm pain along with it. Those are great examples of visceral referred pain areas. They're actually utilized by medical doctors to identify, are you having a heart attack? Are you having gallstones? What's going on there? Most people don't realize there's muscles that are associated with this as well. So with sinus issues, for example, if you have chronic sinus issues of some sorts, maybe like a viral infection or a mold issue, you name it, maybe allergic reaction, chronic histamine issues, the muscles associated with the sinuses will become functionally inhibited. And so what will happen is they'll just get kind of weak. So you'll get imbalances of them compared to other muscles. So the muscles associated with the sinuses are the sternocleidomastoid muscles, which are your neck flexors, but also neck extensors. So basically, if you have sinus issues, your neck is going to be dysfunctional, front and back. If that's the case, and you have all these fascial connections that go up into your jaw with that, if those muscles don't work, do you think you're going to have jaw pain? Probably. Pain usually, in my opinion, is rooted in myofascial dysfunction. Yep. Period. A lot of people say, "Oh, bone's out of place," yada yada. I would argue that myofascial dysfunction is what leads to the bone out of place theory and the bone out of place subluxation that needs to be adjusted. And I think you agree, Dr. Joel. But that's just one example. In addition to that, jaw issues are also tied to blood sugar issues. And so a lot of times people will say, my jaw just kills me. After I eat, my jaw gets real tight. Or I notice if I have something really sugary, my jaw will hurt. Well, that's because it has ties to dysglycemia issues. Other immune system issues. So jaw issues can also be tied to spleen dysfunction, thymus dysfunction, basically where they need support to fight off things that the immune system is dealing with. So if it's anything immune system at that point, that's just a whole nother can of worms. The list goes on. It can be tied to all sorts of other things. But before we even get into all that stuff, Dr. Joel, do you want to get into anything more specific with that? Or I guess what else would you add? Because we can just go on.
Yeah, no, I think that's the meat of our of this episode, is really talking about, hey, what actually underlies a lot of these dysfunctions. I think first understanding, hey, that this joint is very different from most. It's a hinge joint. It's a kind of a hanging joint, as you talked about, and it's driven by fascial dysfunction, fascial imbalances, and those are usually driven by internal things, lifestyle things like that. I think one thing to add too, you talked about kind of the traditional chiropractic approach, trigger point work in the muscles around in the temporalis muscle, which actually goes up into kind of the skull, and then inside even the mouth, and some of the pterygoid muscles and things like that. Some of the masseter muscles, working on those muscles can be helpful. But ultimately, that tension is coming from internal sources. Just like when you have stress and your shoulders get tight, okay, there's no issue with your shoulders. It's that the tension is the inflammation, the cortisol, the stress in your system is driving that. And so in the same way, we have these underlying functions, underlying issues or stressors that will drive it. The only other thing I'll kind of mention here is like the mainstream medical approach with this is oftentimes it's a little bit silly, but it's kind of like, all right, like let's, take a couple weeks or a month or so and not move your jaw very much. And it's like, okay, that doesn't fix really anything.
Yeah.
And then it's kind of like, I don't know if you've seen this video, but there's a video that's kind of like, it's a joke, but the doctor's like, all right, what hurts you? And the patient says, when I do my arm like this, and the doctor says, oh, okay, don't do your arm like that. Thank you. Have a nice day. And it's like, all right. So you have that piece. And then a lot of times, if there's a lot of inflammation and pain, of course, then they're looking at how can we suppress the pain? Steroid shots, ibuprofen, different prescription drugs. And again, that doesn't actually help restore function and get rid of the dysfunction. There's other things. A lot of times people talk about stress, especially with teeth grinding, which teeth grinding, also called bruxism. A lot of people deal with that. And we find that often comes from cortisol issues. Cortisol issues could be driven just by stress in general, cortisol being that main stress hormone in our body, or could be driven by other things, chronic gut issues, parasites, bacterial issues, fungal issues, severe food sensitivities, things like that. But again, the whole point here is oftentimes the treatment or the recommendation for getting this better from our mainstream healthcare system is really inadequate at actually helping the body to heal itself and restore function. So in order to restore function, though, we have to understand what is gone wrong, and that's where we get into these things. So you mentioned blood sugar issues. Hormone issues is also super common, especially in women, because of how estrogen impacts ligaments and the disc that it sits right between the temporal bone and the mandibular bone. That disc is what the jaw kind of hinges on. It's made up of ligamentous tissue. It's basically a thick ligament. And so when we have blood sugar issues, well, that impacts our ligaments. When we have hormones, that impacts our ligaments, and so forth. You mentioned immune system stuff. Just clarification, you mentioned the spleen and thymus. Those are our main two immune system organs. And so to our listener, that means, hey, there could be something going on with your immune system, a chronic infection, a chronic food sensitivity, heavy metals, an imbalance from your immune system due to vaccines, things like that, and so forth. So have we covered all these underlying issues, or should we go into these a little bit deeper, Dr. Tim?
I say let's go into these a little deeper, because I think this is going to be a good light bulb for a lot of people, where they can hopefully connect this with some of their problems that they have.
Yeah, totally.
So we did already kind of talk about blood sugar a little bit. We could dig into that more. Same with immune system issues. But really, I would like to get a lot into pelvic instability, because I think that is a huge kind cause for some stuff. So, um,
Yeah.
but anyway, what would you add about blood sugar issues systems?
Yeah. So with blood sugar issues, I touched on it a little bit there. When your blood sugar drops, what's going to happen is you're going to develop, when your blood sugar drops due to inadequate protein amounts, stress on your liver, whatever's going on with the blood sugar, it's going to increase cortisol. Cortisol is going to spike, and cortisol is going to negatively impact your ligaments. It's going to negatively impact the disc in which the TMJ kind of rotates. And then in general, it's just going to cause more tension throughout your system. And so with that said, one of the things that we always want to consider and address is with the blood sugar is really looking at our nutrition. And of course, most people, we've talked about this in so many episodes, so we'll just keep it more on the brief side with talking about blood sugar. But most people think, okay, my blood sugar is low. You know, when your blood sugar starts dropping, that's when you kind of get tired. If you eat something and your blood sugar spikes, you usually feel really good for a bit. But after your blood sugar spikes, it usually drops. And so we're talking about not just high blood sugar, low blood sugar. We're talking about your body balancing and maintaining a stable blood sugar. And one of the keys with that is actually not carbohydrates. Most people think, oh, my blood sugar's low, I need carbs. I need sugar. That's not actually the approach you want to take. Your body, unless you've been fasting for weeks, your body has enough sugars and so forth that are stored in your muscles and in your liver. And the number one thing that helps your body to utilize that is it's the liver, but it's protein. And the protein helps to support and strengthen the liver. And so that's why a lot of times with blood sugar issues, we focus on protein. Hey, you get 3 meals a day, space them out with no snacking in between so that when your body gets the meal, it can process it through a 4 to 5 hour range. And that meal should be focused on protein. And so this is not just a way to eat for TMJ issues. This is a way to eat for everybody to help with blood sugar stability. And with proper and good blood sugar stability, people will have better energy. They'll have less cortisol. They'll have better balanced hormones and all this stuff. So I think
you wouldn't consider this the TMJ diet, yeah?
I wouldn't consider this the TMJ diet because while TMJ people should be eating this way, pretty much everybody should be eating this way. So
yeah, agreed. This is the everybody diet. This is the diet to be healthy in general.
Yeah. Totally. And a real quick side note, Dr. Tim, a lot of times I think people will, you know, when we kind of say, hey, this is the bar, this is what we should be doing, and this is what's healthiest. A lot of people say, well, I try to eat protein and I don't digest it well, or I feel nasty or whatever it is. That is kind of a sub-level like issue that we need to fix. We need to support digestion. We need to get your digestion improved. That's not normal. And so a lot of times I tell patients, hey, that's not normal. We need to fix that. And then you'll be able to do the things that the rest of your body needs. So I think that's a good little thing worth commenting on there. So that's the blood sugar issues. I want to get into the pelvic stability issues. Let's real quick touch on the immune system a little bit more. When we talk about the immune system, I mentioned chronic infections, chronic food sensitivities, gluten and dairy are probably some of the most common ones. We mention heavy metal toxicity, immune system imbalances from vaccines. Essentially what we're saying is if you have any of these different immune system issues potentially going on, and it's going to take a little bit of investigative work on your own behalf if you're listening to this. If you have any immune system issues and you have TMJ problems, look at the history, look at the timing of things. Okay, I started reacting to gluten a bunch, 3 years ago, and then a few months later, my TMJ started acting up. Or, hey, I got these shots a year ago, and a few months later, the TMJ started acting up. Look at the timing of things, and a lot of times that timing will tell you everything you need to know. But also, it's important to just consider that, hey, this one part of our health, which we think is isolated, the immune system, and separate from the TMJ, it's probably related. So I think it's a good thing to consider. Talked about the sinuses. I think we're good there. One last thing to mention with the sinuses, I think, Dr. Tim, is that sometimes oral issues, like issues with your teeth, teeth infections, stuff like that, can sometimes drive sinus problems as well. and there can sometimes be a connection there. So just something to be mindful of. But I think that for the most part kind of covers those things. So anything else to add to that kind of was sparked in your mind? Otherwise, I think there's a lot of stuff here we can talk about with pelvic instability.
Yeah, let's get into that, because that list it can be quite long. So
Yep.
when it comes to pelvic instability, I like to look at it from a couple different avenues. First of which is, honestly, gut issues are super common there. I can't tell you how many patients I have that come into the office that say, I've had back pain for 15 years, and I've been to chiros, PTs, massage therapists, dry needling, acupuncture, you name it, all this stuff, and nothing fixes it. And then you're like, okay, well, how's your gut health? Could be better, could be worse, not a huge deal. But when you start digging through things, you find out, well, although things aren't optimal or aren't terrible, it's a big inflammation factory that's going on in the gut, and it causes all of the back muscles to just hold on really, really tight. And when that's the case, you can get where some hold on too tight, others let go, and you get just this imbalance of forces. With the case, things do not want to hold on well. And so there is a direct correlation between pelvic instability and TMJ instability. The way that I like to describe this, I truly think it goes back to this. So with the diaphragm, so your diaphragm, yes, you breathe with your diaphragm, but most people don't realize your diaphragm has fascial connections with your tongue that goes, of course, all the way up into your mouth, but then also has fascial connections with your psoas muscle that goes from the back of your diaphragm down your spine through your pelvis and attaches on the side part of your femurs. So diaphragm coordinates stability from your head all the way down to your legs. And that is trunk stability, it is involved with it. And so if you have pelvic instability due to it disrupting diaphragm dysfunction and the fascial connections with it, you can get where the TMJ is not stabilized properly as well. And so imbalanced forces equals pain or dysfunction. Regardless of whether it's just a regular old diaphragm issue and you just need to do a rehab thing, maybe a breathing position or things like that to fix it, or if the diaphragm thing is more a symptom of inflammation through the gut or hormone issues or something along that line. Either way, I do truly believe that all those things correlated, and that's where that connection is. Within our training, a lot of times it's just, that's just how it is. There's just this connection. It's just what it is. But my thought process is always, well, why? I always want to know why.
Yep.
And that's the beauty of the techniques that we use, is we can use it to basically experiment and figure out, okay, well, what indicator are we gathering, things are dysfunctional, and what's fixing it. And oftentimes I'll find indicators for diaphragm issues. And then if you treat the gut, if the gut really, really is a problem, that will then go away and it'll stay good. So gut issues, super high on that list. And by gut issues, I mean, typically gut infections, some sort of inflammatory driver that's going on there. And usually herbs are the fix for it. Hormone issues. So back to the organ muscle relationships. I'd love to hear your take on this, Dr. Joel, but hormones, one of the most common issues that I will see when it comes to jaw issues.
Yeah.
Reason for that is, one, the muscles that are correlative to the reproductive system are the muscles, the piriformis, all of basically the pelvic stability muscles. So pelvic instability, going right back to that. That's the case, of course, that same connection with the diaphragm. But what you can also get, and we've talked about this in the hormone episodes and stuff like that, called uteratosis, where the uterus will kind of sag when it's chemically irritated due to some sort of hormone issue, or even like a physical issue, like an IUD or something along that line. There are fascial connections that connect the uterus to the spine, and then ligaments that run along the spine all the way up into your neck. And if you have something tugging downward from the base of your spine or your sacrum and your pelvis, you're going to have pulling up here. So we can test this and see it, that pelvic muscles will overfire in this instance and the neck muscles will turn off. Well, if that's the case, then of course we're going to have TMJ issues. And what's the fix there? Well, if it's involved with something like an IUD, due to it just being something that is foreign to the body, consult your prescribing physician about moving it. That's our advice there. But there's also chemical things that you can do as far as it goes for detoxifying hormones, kinds of stuff like that. Beyond that, adrenals can be involved as well. And I believe that ties directly into blood sugar issues, clenching of the jaw, things like that. But then also it could just be just a regular old diaphragm thing where just need to stabilize the diaphragm and stabilize the core.
Yeah, absolutely. So no, so you've gone through kind of our list here and really explained a lot of these things well. But I think just to reiterate, kind of from a super high level, essentially what we're saying is we can have different internal issues going on, whether hormone imbalances, gut issues, core stability, diaphragm issues. You're saying that we can have these issues. It can throw off our pelvis, and because of the fascial connections, that all the tissues connected from our pelvis up into our neck and our jaw, it can then cause jaw issues and tracking issues. That's essentially what we're saying, right?
Yeah, absolutely. Just like we said before, like traditional chiropractic philosophy or PT, whatever, just body working philosophy, myofascial issues. It's musculoskeletal. Why though? And this is the why. It can be tied to all these things, and that's also the reason why if you don't deal with these things, why is it not going away? Well, because there's these underlying issues.
Yep, totally. Agreed. All right, let's do this, Dr. Tim. As we start to wrap up here, let's kind of jump into, hey, what would our encouragement be to someone that has this issue? I think to start, what we would generally say is, hey, if you can work with a holistic doctor that does applied kinesiology and specifically systems healthcare, like Dr. Tim or myself, I think we would say, hey, that's going to give you the best and quickest approach at getting to the bottom of issues and starting to address things. But outside of that, what else might our encouragement be as far as you've got this issue? What are some ways you can do to start trying to support your body and healing itself, trying to start find relief and things like that?
There's a lot that can be done there. Unfortunately, I think the list is pretty long. But
let's do this, Dr. Tim. How about this? In general, we do this with a lot of topics when it's like, hey, what can our listener do? Well, I think in general, the first thing is kind of investigate a little bit. So we've shared a lot of different topics. What we want is for you to consider these topics in your own health. So if you have hormone imbalances, and you have hormone imbalances, maybe for a female, if your cycle is not consistent, you have significant symptoms, heavy flow, all these things. Of course, if you have an IUD or you're on birth control, that's already going to throw things off with your hormones internally. But if you look at yourself and you're like, hey, I have some hormone issues. Okay, I would definitely consider that as far as possibly being a factor. And then you would kind of pursue that route and really try to investigate that further. And of course, we've got different episodes on a lot of different topics. And so those would be something to consider. If you have gut issues, you've had gut issues, diarrhea, constipation, bloating, gas, then you would look at that and say, you know what, I've had this a while. It maybe you notice when you eat certain foods or certain things that your TMJ gets worse. Okay, that's huge information. In our appointments, Dr. Tim, a lot of times for our first visits, we dive into all this stuff and we really kind of play investigator and figure out, okay, what factors are involved here and where is this coming from? And then, of course, our kind of superpower, if you will, is jumping into the muscle testing and figuring out, not only, okay, we know there's some hormone stuff going on here, but what specifically do we need to do to fix it? But I think the first and foremost for our listeners is go into investigative mode and consider these different things. If you have, here's the short fix on this, Dr. Tim, is if you have blood sugar issues, start eating 3 meals a day, getting enough protein. Listen to some of our nutrition episodes, and we have a blood sugar episode. I think it was episode 1 or 2. Listen to that. That could be
1
and
and 2.
helpful.
I think both talk about it quite a bit.
Totally. We talk on it in every episode.
We talk about it too much. Yes,
we do. But if you have gut issues, listen to some gut episodes and consider some different herbs and things like that and changing your nutrition. Poor core stability and diaphragm issues. That's one that we could probably touch on more. We probably should have an episode just on that because I think there's a lot of things there. Diaphragm breathing can be extremely helpful. I find that I find that walking and diaphragm breathing can be super helpful with just helping the fascia in there, in your core and with your diaphragm. And then adrenal dysfunction. If you have adrenal dysfunction, that's usually going to mean You wake up in the morning, you're kind of tired, can't really get out of bed. You get to the afternoon, you kind of crash. Maybe you get headaches in the forefront of your head. There's other symptoms as well, but we have different episodes on that, so consider that. I think adrenal fatigue is probably the big one there. But consider listening and investigating some of that more. Anything to add to that, Dr. Tim? And then we've also got some myofascial, like some areas on the body that they can massage to attempt to help with some of these things. But any other thoughts to kind of add there, Dr. Tim?
Just like you said, collecting data, figuring out what makes it better, what makes it worse. If you have issues, dial that in. If you got blood sugar stuff, dial that in. Even if you don't think you have blood sugar issues, I cannot tell you how many patients I have that have phone consultations before they come on in, and they're like, "Oh, I eat great. I have no blood sugar issues," and they come in and they've got blood sugar issues. Who thought? It just happens. It's a thing beyond even just regulating blood sugar through diet. It's underlying inflammatory drivers and other things that can irritate. And so, if you think you're perfect, I guarantee you're not. 3 meals a day, 5 hours apart, plenty of protein and fat. I on the front page of my website have a free book to download. It's called my stress ebook. In there, we highlight the diet and talk about all that stuff. Listen to the podcast, the first 2 episodes on how to do that. Whatever you got to do, start doing that'll be helpful. But to your point about like reflexes and points in the body that you can massage, figure things out. So we are all about testing and then rechecking. Test, recheck, fix something, recheck. So say your jaw hurts and it feels like it really can't open all the way. Try to see how far you can go, open up, see how things feel. You experience pain, can't open all the way. Okay. Well, say you have, you have like, pretty stiff low back. You struggle, you feel real tight in the morning. Maybe you struggle to, breathe in certain positions. If you lay on your side at night, you feel like you can't get a full breath or things like that. That could be a sign of diaphragm issue. And so reflex for the diaphragm, it basically sits on your sternum. It's a little bit different for everybody, but I found that the most common place that I'll see it is basically there's a little notch like right by your throat. It's called the sternal notch. You follow that down a little bit and there's a little bit of a shelf. There's a bone, the top bone of your sternum is called the manubrium. And then right below that, there's a little bump. If you massage right on that bump for about a minute or two, if your diaphragm is dysfunctional, this will normalize function of it. If that's a big driver of dysfunction with your jaw, you should be able to see how your jaw feels before, move it however it feels. If it hurts in whatever position, do that, try to provoke it, and then massage that reflex for a minute or two, and then see how things feel afterwards. Usually you will see a pretty significant improvement if that is the driver of your issues. Now, say you've got a hormone detox issue that's causing it. Well, you can do the same thing, but for the liver reflex, which sits basically right where your liver is. It's probably, I don't know what rib space that would be, maybe 7, 8 or so on the right side. Honestly, just all the nip line all the way down. And usually when you massage these reflexes, they're going to be really tender. And so they're going to be pretty easy to locate. If you want to do a Google search, Google Chapman's reflexes. And there's a lot of decent charts online that will show you where these are at. And as long as you massage these reflexes for about a minute or two, if that is the driver of your issues, or at least that organ is the driver of your issues, it will temporarily reset the TMJ issue and allow things to move better and relax, and pain will go away, or at least decrease. If that is the case, then that at least provides you the data that, okay, well, I massaged that reflex, fixed, in quotes, fixed that organ issue, and things felt better. So that says, hey, if you massage the liver reflex and that fixes it, well, I've got an issue with my liver. And most people say, well, I don't drink. What's wrong with my liver? Probably just a hormone detox issue. So you need to work on detoxifying those hormones. So listen to our hormone episode and how to work on that. Beyond that, I think that.
Yeah, go ahead.
Potentially doing some diaphragm breathing exercises would be a good idea. The book that would be awesome for people to read, it's called the Breathing Cure and Oxygen Advantage by Patrick McGowan. In that he talks about 9 different diaphragm rehab breathing positions that we'll actually have people do in the office to improve diaphragm dysfunction. So usually people will test for just one position and muscle test to figure that one out. But if you're just doing stuff from home, then, it explains in the book how to go about doing that.
Yeah, that's good. The last thing I'll kind of add to that is when you look at physical treatments, don't just consider the muscles around the TMJ. You really want to consider around C1 and C2 and possibly getting those adjusted as well. That's the upper vertebra in your neck. And then so the upper muscles there, and then the front muscles, the sternocleidomastoid and so forth. Basically understanding that a lot of the fascial tension and tightness around the neck, upper neck, and so forth can increase a lot of tension and issues with the jaw. So Dr. Tim, I think this has been great, and we are out of time. We need to wrap up here. Any final thoughts? Otherwise, share with our listeners how they can find you online.
Final thoughts, gather data. That's my best advice for people. One of the biggest problems that we run into, in my opinion, I'd love to hear if you run into this too, is lack of paying attention to when problems happen. So if you can narrow down when your problems are provoked, at least when they're worse, when they're better, you channel your inner engineer brain, gather data. Even when things are feeling good, gather data, consistent about how you're feeling and how things are doing. As long as you can gather that, you should be able to draw patterns from that and figure out what the underlying cause is. So anyway, do that. And if you need help, give us a call. But anyway, let's wrap up. So I'm Dr. Tim Augustiniak down here in Bentonville, Arkansas. My practice is called Flourish Functional Wellness Center. If you want to find me online, my website is draugustiniak.com. That's draugustiniak.com. On the front page, there are links to all my socials, contact info for the office, all the things. If you guys have any questions, comments, concerns, or suggestions for future episodes, feel free to give us a shout and let us know.
Yep, love it. And I'm Dr. Joel Miller. The practice here is Freedom Health and Wellness in Flower Mound, Texas. You can find me online at drjoelmiller.com. You can find me on Instagram at Dr. Joel Miller. Guys, thanks so much for listening. We hope this is helpful and a blessing to you. We've got awesome episodes coming to you every week, released Monday, 5 a.m. If you guys have any topics you want us to cover, shoot us a message, let us know, and we'll definitely consider it. Guys, thanks so much, and we'll see you guys in the next one.